Having a baby changes your life in some amazing, beautiful ways, but the impact on your body may not be so beautiful, and that is why a lot of women are relying on plastic surgery to get their pre-baby body back. Dr. Nia Banks from Dr. Banks Plastic Surgery is here with more on what you're calling Mommy Makeovers. Good morning.
Good morning.
All right, so what is a Mommy Makeover?
Well, Mommy Makeover is a combination of procedures to rejuvenate the breast and the abdomen in one procedure. So one surgery, one recovery.
Do a lot of women actually get this? I mean, is this a big trend?
It is a big trend. It's a popular procedure. I think all moms are very busy right now, so it makes sense to combine things at one time. And the largest impact with having a child sometimes in your body are the breast and the abdomen.
Now, the breast you may not be able to get back on your own, even if you're trying to do exercise, but the stomach area, is this for people no matter what, or do you say go exercise first and see what you can do, or can you work with anything?
It is best to wait until you've lost your pre-pregnancy weight.
Okay.
And we obviously do want you to be healthy, so we want you to work on your own first, and then what you can achieve, we can help with.
All right, let's show some pictures, because you're seeing some amazing results here. Now, here's a before and after. Tell us what we're seeing in the before versus the after.
So on the left side of the screen, you're seeing a before shot, and this is a typical abdomen after pregnancy. Not a lot of stretch marks, but some stretched abdominal wall muscles. And sometimes you can find that those muscles don't respond to exercise.
Okay.
And so if you've gotten to that point and things are just not tightening up, sometimes the answer is a tummy tuck.
And because that doesn't look bad, it just, like you said, it doesn't look as tight. It's a little softer.
Not as tight as what she was used to.
Okay, so you were able to pull that back in. All right, let's see another one of the other picture, because this one I think a lot of women have, and then they don't know what to do. It's like extra skin.
Extra skin. There's extra skin there. There's lots of stretch marks, and the stretch marks are where there actually breaks in the collagen because the skin is expanded so fast it wasn't able to respond to it. And that's not going to go away on its own. No matter how much you exercise or diet, that skin, those changes are permanent. And so that's a really good indication for an abdominoplasty.
And so for that, you can't get rid of the stretch marks. They're there in your, but that's a dramatic difference from before and after.
We can excise them. There's not a lot to get rid of them.
Right. And so you do that procedure along with doing something to lift the breast again.
Absolutely. But the back where they belong, they do. But that's what everything is there for. Your abdomen is meant to stretch. The skin is meant to stretch. The breasts are meant to deliver milk. But afterwards, it does create some permanent changes.
The recovery time for doing that, what is that like?
It depends on the combination of procedures that you have.
Okay.
In general, you can expect between 2 and 3 weeks. And in that time, you're not going to be allowed to lift more than 10 pounds. You need to take that into consideration. If you've got young ones at home, you're not going to want to lift them for that first couple of weeks.
And what's the price range in here?
It depends on what combination of procedures that you choose. And so there's going to be a cost for the professional fee, there's going to be a cost for anesthesia, and a cost for the facility. And most of these procedures are done under general anesthesia in a certified surgery center.
Okay, so you can be in and out the same day?
In and out the same day.
All right, well, for all of you mommies out there, that's an option. Thank you so much
for
coming
in.
Appreciate it.
Thanks for having us.
Well, coming up in our 8 o'clock hour.